Welcome to the Aaron Harber Show, Colorado Business News. And today in our continuing series with members of the Colorado General Assembly, I have three members of that august institution joining me today. And I'm going to let them talk a little bit about the committees they're on and probably just as importantly, where they're from. We're going to start off with State Senator Linda Newell. Linda, tell me just a tiny bit about your district and where it is.
Sure, absolutely. First, I want to say thank you for being here. It is, I so respect your work. So thank you. My district is one of the most purple in the state, meaning Republican, Independent, and Democrat. And it is Littleton, Inglewood, Sheridan, Cherry Hills Village, Greenwood Village, and parts of Aurora, and a couple of other towns in there. And I serve on Health and Human Services Committee. I've served on Judiciary, Business, Labor, and Technology, Joint Technology Committee, and the Ethics Board.
Great. And Senator Beth Martinez-Humenick, tell me a little bit about your district.
Thank you for having us today. I am in Adams County. I have Senate District 24, which encompasses almost all of Thornton, all of North Glen, and about a third of Westminster. And I currently serve during the session on the Local Government Committee and the Health and Human Services Committee, as well as the Joint Technology Committee. And then during the interim, I've been serving on a large number of committees, so really have been very busy.
Great. And on the other side of the chamber in the House, Joanne Windholtz, thanks so much for being here.
Well, it's my pleasure. Thank you for having us. This is my first term, and it's been very exciting. My learning curve is still going straight up. My district is Adams County, and we were able to make a dent in that part of the state, so in the metro areas, we're very pleased to have two Republican representatives coming out of there now. I served on the Education Committee, which was very interesting this last year, and also the Health and Human Services in the House. So we all three have a piece of the pie on that one. So.
All right, so we have two Republicans. Linda, you're outnumbered 2-1 here, but you know Colorado has the highest percentage of women in its legislature compared to the rest of the country. What are those implications? What does it mean for you, Joanne? I'm going to start with you. How is that? What is that? What are the impacts of those numbers?
I think that one of probably the most primary impact is that bringing a tone, in my instance, a conservative tone of the women's issues and that come up that we can address very openly, and find that, especially in Health and Human Services, it does have a lot to say on what's going on.
Beth, what's your take on that?
Well, I think that traditionally it's been men in the state legislatures, and I do think that we bring a different perspective to things. Plus, we're used to multitasking, so we can go from one thing to another pretty easily and seamlessly. Not always, but we try. But
are you intimating us guys just aren't that good at that?
No, I'm not saying that at all. There are some folks that are really good at that. But I do think
it's okay. You can say it because we all know it's true, right?
I do think that since it has traditionally been a male-dominated environment, that perhaps some very good women candidates or folks that would think about running might not do so because they're looking at, well, gosh, I'm going to be one of maybe 4 or 5. What's the success rate going to be for myself? But you have to have a lot of self-confidence, and I do think that we need to really encourage young women and women of diversity and color to run as well.
Well, of course, the Speaker of the House, Dickie Lee Hullinghorst, is a woman. The first woman Speaker, I believe, was Lola Spradley. Yes. From Pueblo. So, and certainly women have always played such a major role in Colorado politics. But tell me about what the impact is and your take on this, Linda.
Well, research shows that when women are in leadership in government, that children and families do better. That the policies and the fair rules for everybody in the middle class, for instance, they just want to know are the rules fair? And if I play by the rules, can I get a shot at it? And the research shows that, yes, women in charge do that. And I believe also another strength of ours is collaboration. That we are often, now not always, but we are often more collaborative and more able to come to consensus and take time to honor the process of consensus rather than potentially steamrolling things through or not delving as deep.
Mm-hmm. Is it time for men to step aside and stop running for office? Is that what I'm hearing?
No, I just think it's time for more young women and women to be encouraged and feel confident in being able to run for office, because we do serve a lot of people, and I think that we can do it very well, and hopefully we are all trying to do it very well in our positions currently.
Do you think, just based on your experience, I know whether it be new or having been in the House and or Senate, do you think there's more collaboration among women across parties than there is among men across parties? Do you have any sense of that?
Interesting.
Please, go ahead.
That has been my experience, actually. If I am, and I am constantly trying to work in a bipartisan or even nonpartisan way, and so I have reached out to many people, and some have reached out to me too. Even being in the minority, you'll get requests because of the successes. I've been very fortunate. I have had many of my successes been bipartisan, and mostly it's because of the women I've worked with.
Well, Beth, you and Linda are both in the Senate on opposite sides of the aisle, but because it's 18 Republicans and 17 Democrats, I would assume there often has to be a lot of collaboration to get bills passed. Is that true or not?
That is true, and I was fortunate because I had 7 years on a local city council in my community of Thornton, which I think really helped prepare me for this. And I was used to working together collaboratively to get consensus so things could get done. So very early on, I reached out to my counterparts on the other side of the aisle because I do want to get to know them. We do spend a lot of time together for 5 months, and then also during the interim on different interim committees and commissions. So it's very important to get things done, and I think that that's one of the ways to get things done is to collaborate with other folks. And it's not just the women. I've reached across the aisle and done bipartisan bills with men on the other side of the aisle as well, and I think we need to continue to do that.
So many of the issues are bipartisan. They're not just one, because if it's just one total side, it's not going to happen. And if you really want to get things done, you're going to reach out, and that goes coming and going, men and women. So we feel fortunate.
And you're in the minority in the House. You have 34 Democrats, 31 Republicans.
Correct.
And so, but even though that's not a one-vote difference, that's a pretty small gap.
Well, it is, and the fact that most issues are bipartisan. You know, and when it comes to the education and health care, I mean, we're all involved. And so to get that perspective, to understand where we're each coming from, most times there is a good, strong result coming out.
Okay, well, we're going to take a quick break. When we come back, we're going to hear from our 3 legislators what their expectations and hopes are for the 2016 session. So stay tuned for more.
For information on how to help promote civil and mutually respectful discourse and support expansion of the distribution of our programs, please email info@harbertv.com.
Hi, I'm Aaron Harber, host of The Aaron Harber Show. For information about the program, who our upcoming guests and topics are, and ways you can participate, please go to our website. That's harbertv.com. And most of all, thanks for watching.
I'm Mary Robinson, former President of Ireland.
Hi, I'm Jim Cameron, Director of Avatar.
I'm Christina Johnson, former Undersecretary of Energy.
Hi, I'm Oliver Stone.
Hi, I'm Mike Peters. I'm the creator of Mother Goose and Grimm.
Watch The Aaron Harber Show.
I would encourage you to watch The Aaron Harber Show. It's good fun.
Watch The Aaron Harber Show, because he's a really cool guy.
Please watch The Aaron Harber Show, on which I do appear.
I want you to watch The Aaron Harber Show. Grimmy watches it every day.
I'm Aaron Harber, host of The Aaron Harber Show. You can follow the show on Twitter and find us on Facebook to get all the latest updates, see behind-the-scene photos, and make comments and ask me questions. You can see episodes before their TV broadcast, so like the show today.
Your opinions, ideas, suggestions, and criticisms related to guests, topics, questions, or the host are welcome. Please send an email to producer@harbortv.com.
Welcome back to the show. This is part one of our two-part series with three members of the General Assembly who happen to all be women and have convinced me that we need more women in the General Assembly. I'm not going to ask you if we need more Democratic women or Republican women. I think I'll get I think I know what the answer is from each of you. With two Republicans and one Democrat, you're probably going to be outvoted, Linda. So Beth, tell me about the 2016 session. What are your expectations in terms of what are the big issues going to be? And then personally, any legislation, is there a piece of legislation in particular that's really going to be important to you that you hope to author?
I do think that this next session is going to have a lot of healthcare bills brought forward again, perhaps some additional workforce development bills, and also we're going to be taking a look at transportation. Those seem to be heavily on folks' mind here in Colorado, and it affects everybody. Those things affect everybody. So I think we are going to see some legislation come forward. Now, as we know, it doesn't always move forward to fruition, but there are some people that are working, plus the interim committees and commissions are currently working on draft bills, and some of those may move forward and they may not.
One of the interesting things I think a lot of people don't realize is that when the session ends at roughly the first week of May, your work doesn't end. I mean, this is really a full-time position in terms of the number of committee meetings, interim committee meetings, the studying you have to do, assisting constituents, reaching out to your districts, and you get and I'm willing to say this because I'm not in the General Assembly, you get paid very little.
That's true.
Why don't, is the base salary like $30,000 or something like that for both members of the House and Senate?
Even though we have twice the constituents.
Right. And
usually Senate, twice the bills.
Right. There's 35. So you're working twice as hard. You're arguing. I don't know if your House counterparts would necessarily agree with that. I mean, they probably say, well, because there are twice as many people, I have to work 4 times harder just to be heard. So, but why don't we pay people more? When I was on the board of trustees of a university and had conversations with the treasurer of the university, and the university had proposed some significant pay increases, and as a trustee of the university, I was concerned about the cost. He looked at me and said, "Aaron, just remember, he who pays peanuts gets monkeys." So I always remember. I'm not referring to the General Assembly, but I think most people would agree for a full-time job, the kind of commitment you make, the hours you put in, that's not much money. And even with per diem and all that, it's still not much money. Should something be done about it? And why hasn't something been done?
Well, actually, something has been done, and but trouble is most of us may not see it because it doesn't go into effect till for 2019, and it's not a big raise, but it's something, and so.
Going to what? Going to how much?
38.
Oh,
yeah.
I mean,
I know it's still.
if you're going, why don't you go big to 50 or 60 or something?
Well, it's called the budget, and so that has a big piece to play in it too. So.
And it's also perception by the public. They think that we make big bucks anyway, and that we're getting paid huge salaries because they see what's happening on Capitol Hill in Washington D.C. And that's very, very different from what actually happens stateside here. However, in talking with legislators from other states, they actually have different things in place so that they might have a special commission or committee that actually does the raises on an annual basis for the legislators. But most of them that I've talked to make a lot more than we do here in Colorado.
And it's not only our pay, it's also that we don't have any staff. And other state legislatures have staff. They mostly have staff year-round, at least 1 or 2 people even. They have resources for their Senate districts or House districts. We don't have that. In Colorado, we are one of the lowest, not only paid, but also the lowest resourced. So it really does affect the constituent. The constituent is sitting there emailing us, and we are lucky if we can get the volunteers to help us. So it is a serious problem.
All right, so speaking of serious problems, Linda, what are your expectations for the 2016 session? And if you have a special piece of legislation you'd like to see passed, what is that?
I am anticipating that we will see some issues in healthcare. For instance, one of the issues the chronic care folks and I are working on is if you have a chronic condition and you are on a particular prescription, there are insurance plans that will try to kick you off of that to get onto another drug that they might think is cheaper. But if you're in a chronic condition, that can decompensate you like that. So the doctors and I are working on that. That's one issue, especially mental health in this state. And when it comes to business, the effect that it has on business is huge in Colorado.
In terms of what? Tell me more.
Well, the costs are productivity, lower productivity. The cost of medical untreated depression is huge. It costs about $2,000 per year per employee for a business for untreated depression. The costs of absenteeism, of not being able to keep employees because they are not in treatment, or they might need treatment that hasn't been identified. So I'm working with the business community and the Suicide Prevention Commission on some of our recommendations. I serve on that. So we are looking to help with solutions to work with the businesses and figure out what we can do together to. People do need to know we have the 7th highest suicide rate in the country. And that affects every one of us. There's not one person in this studio right now who hasn't known somebody or known of someone who has committed suicide. And we need to find not only solutions, but then we need to act on them. So I'm hoping to do that.
One of the things that I've been working on this interim is I've chaired the mental issues in the Juvenile and Criminal Justice System Oversight Committee. And the task force is going to be working on some things for next year because we've got some problems in that sector too. And you know, early childhood is another area of discussion that's been going on. Some people don't see the importance of working with kids before they go to kindergarten. Other people are saying, and there are scientific studies being done at universities, major universities across the country that show that working with children early on help them be successful in kindergarten and throughout their entire education until they graduate from high school and then move on to either a technical school learning a skill or to college.
I was going to say, as far as children are concerned, the drug Ritalin, and sometimes, you know, do these children really need this drug? And what's the long-term effect of this having on them? And so that's an area that I'm looking at as far as what kind of research, you know, and do can Colorado, which we have this wonderful medical with CU and children's here already. And fortunately they're in my district, but I would really like to see a study in that done as far as drugs' effect on young children.
Well, I think there certainly is a growing amount of opinion that we over-medicate young people, and I think there's growing potentially unanimity on that. I'm not sure what we do.
And particularly those in foster care.
And it's not just young people, it's also our seniors that are being over-medicated as well, because it's easier to work with them very oftentimes if they're just sitting there. But what kind of quality of life is that for that individual? And that's something that I keep trying to remind folks. So one of the bills that I'm working on right now has to do with assisted living administrator competency, because that is the fastest growing segment of our population, is the over 55, over 65 folks here in Colorado. And right now, there's no requirements to be an administrator of one of these facilities, and yet you and I and people out there entrust them with our loved ones for their care, et cetera. And they might have business, experience, but they may not have the other health experience that they need, or to be able to actually provide the adequate training that their staff need. And things are changing in medicine all the time. And so I was happy to help sponsor the telemedicine bill this year, which will also help with assisted living centers and doctors' offices with mental health issues. There were child psychologists that were very excited about that because that would give them more opportunity to actually provide services and listen to their youth clients in a setting where they don't have to be traveling for 7 hours to get there and only have a limited amount of time. So I think there are a lot of big things coming up in this next session. One of the things that I want to make sure that we focus on is continuing the collaboration, because people in Colorado expect us to get things done. And just because it's a major election should not be a hindrance to getting what needs to be done for the people who live here.
Okay, we're going to take a quick break. When we come back, I'd like to talk a little bit about funding for mental health and what the challenges are there. So we're going to take a quick break. We'll be right back. See you in just a moment.
For information on how to help promote civil and mutually respectful discourse and support expansion of the distribution of our programs, please email info@harbertv.com.
Hi, I'm Aaron Harber, host of The Aaron Harber Show. For information about the program, who our upcoming guests and topics are, and ways you can participate, please go to our website. That's harbertv.com. And most of all, thanks for watching.
I'm Mary Robinson, former President of Ireland.
Hi, I'm Jim Cameron, Director of Avatar.
I'm Christina Johnson, former Undersecretary of Energy.
Hi, I'm Oliver Stone.
Hi, I'm Mike Peters. I'm the creator of Mother Goose and Grimm.
Watch The Aaron Harber Show.
I would encourage you to watch the Aaron Harber Show. It's good fun.
Watch the Aaron Harber Show because he's a really cool guy.
Please watch The Aaron Harber Show, on which I do appear.
I want you to watch the Aaron Harber Show. Grimmy watches it every day.
I'm Aaron Harber, host of The Aaron Harber Show. You can follow the show on Twitter and find us on Facebook to get all the latest updates, see behind-the-scene photos, and make comments and ask me questions. You can see episodes before their TV broadcast, so like the show today.
Your opinions, ideas, suggestions, and criticisms related to guests, topics, questions, or the host are welcome. Please send an email to producer@harbertv.com.
Welcome back to the show. We were just talking about mental health. So, Joanne, I want to start with you. Clearly, there are significant needs. It seems like this discussion always occurs after some kind of mass shooting or incident, especially with young people, or if we're talking about homeless people, where a significant percentage have major mental health issues. What are the funding needs, and what's the best way to address that?
The funding needs for mental health have been questionable from time immemorial. Actually, growing up, my mother worked at the mental health hospital, and so it was there's a certain amount of fear that a lot of people have when it comes to mental health. Well, that went away a long time ago as far as I'm concerned. But the funding for mental health is, because it spans every age group, and when also for those folks who are incarcerated, and that is a whole different issue. Then we come across those folks that do these horrendous things and they have no record. What were the red flags that we missed? You know, what kind of education do our folks and our teachers and our parents need? So the funding is going to be really, it's not going to be cheap by any stretch, but we have to look at it and we have to address it.
Beth, what's your sense about what we should do?
Well, I think restorative services is a big area that has been neglected for decades now, and that's one thing that the task force is going to be looking at this next year. And you can't take a look at juvenile competency and those types of things without having restorative services available to them, as well as the adults that are coming out of our correctional systems.
So restorative services meaning what?
Meaning that they actually have a place to go to get assistance and continued mental health treatments once they are released, either from a juvenile detention center, halfway house, or from a correctional system. And there are always flags for kids. I'm a substitute teacher when I have time to teach, and quite frankly, I haven't had that this interim. However, you pick up on things when you're in the classroom with kids, and teachers do need to have more training, I think, in this area. My first experience with
parents too, probably.
Parents as well, because a lot of times I think parents are so busy either working several jobs or so tired when they come home at the end of the day. As long as their kids are home or they know where they are, they're not really often questioning what they may be paying attention to online, what friends they may be hanging out with, associating with, etc. And I do think that because we've become such a digital age, that the communication and the human interaction has gone away, and I do personally feel that that's contributing to some of these issues when people feel alone and not having any friends and don't know where to turn. Because we don't want to have more suicides either.
Right. Yeah. I'll add that I serve on the School Safety and Youth and Crisis Committee, and we've been working this interim, and I can tell you that a bill that probably will come out of that committee is for more training for teachers, parents, students, staff in mental health first aid, in how do I see those signs. But to answer your question about funding, the good news is through the Democratic majority that we've had over the last few years and the Governor Hickenlooper, we have put more funding into mental health than in the last 40 years. In the state of Colorado. So we have done a great job of showing this is a priority, although it needs to continue. There is one untapped resource that we can use that was defeated last year, which was the hospital provider fee, and it was defeated in the Senate on a party line vote. And it really is one resource that doesn't even come from our general fund, that it just taps into it from the hospitals. So I just wanted to throw that out there, that we should probably be talking about that next session too, and see if we can get to some collaboration with both parties.
Funding with regards to mental health, I think, is going to be discussed more on Capitol Hill in Washington, D.C. too, in light of things that have been going on across the country. Do we have enough funding? No. Where the challenge is trying to figure out where we're going to get the funding in the budget, because we already have a lot of things that have to be funded based on prior bills. So what are you going to cut in order to start a new program, and where's that funding going to come from? One of the things that I have encouraged is to have the nonprofits, the business owners, all of the stakeholders that might be involved that have people that may have mental health issues to work together, because not everything has to be legislated.
Joanne, what about, has there been, and I know you're relatively new to the chamber, and all three of you can chip in, has there been any estimate, there must be estimates of what the needs are. Now, what kind of dollars are we talking about? What's our shortage? What's the gap? And my sense is most taxpayers really don't have any sense of this. We only have a minute left, but give me some quick answers.
As far as health care?
Yeah, mental health in particular.
Mental health in particular, the gap seems to me is for the children, small children, and because those signs are there, and this communication piece is huge, and that's family stability is a huge part. So I think that a lot of that might come through education.
All right, any quick numbers that you know of, Linda?
No, that is a joint budget committee answer. However, what we can do is tap into some federal resources as well as using the private-public partnerships, which we are doing with the Suicide Prevention Commission. So I'm really thrilled that the business community is starting to come to the table with that, and I'm part of that business community. I come from the private sector, so I'm thrilled that we're starting to also collaborate on, this is a priority for Colorado. This is a gorgeous state. Why are we having so many suicides?
Okay, well, that's the end of part one of our special two-part series. Make sure you stay tuned for part two, when these three guests of mine from the General Assembly join me once again.